Hello, my name is Carrie Peterson, and today I'm going to be talking about a policy issue at my clinical rotation for Fieldwork 2A. What that policy is that the patient requires a referral to come in for the initial evaluation. However, we do go through direct access. So what direct access is that the patient has 30 days to get a referral from a primary care physician or a specialist for occupational therapy services. I was familiar with what direct access was. However, in my past experiences, I know that some occupational therapists are not comfortable seeing a patient without a referral from a doctor. So they would just turn the patient away. Now, at my clinical rotation, we actually don't, we do not turn away any patients, even if they don't have a referral. And that's something that I noticed was kind of like a bit of a shock for me because like I know for me in the future as a therapist, I would feel more comfortable seeing a patient if they had a referral from a doctor. That way I know what the diagnosis is versus them coming in and they hadn't seen a doctor and it's kind of just all an inference on what the condition may be. So, so they just require you to get a referral within 30 days of us seeing the patient. After those 30 days, we can't see the patient anymore, and their services for occupational therapy would end, or once they receive a referral from the doctor, then they can come back and schedule an appointment. So I think what I would do in that situation, truthfully and honestly, is that I would talk to the patient myself directly and, ask them a couple questions before actually bringing them in to sit down for the evaluation. Um, I have talked to some of the occupational therapists that work in my clinic that I am at for my field work, and I know one of them expressed to me that they would feel more comfortable if the patient had a referral from a doctor with the diagnosis on it, because she wasn't comfortable putting her license on the line with seeing a patient that did not have a referral. And I completely understood that. And since we are working under the occupational therapy's license, I wouldn't want to bring this patient in for an evaluation and they don't have a referral. And at that moment, we would just be asking a bunch of medical history questions and guessing what the condition may be without really knowing for sure what they may have because they didn't see a doctor and they didn't do any diagnostic testing. So in that instance, I did agree with the therapist, and we actually did turn the patient away. So yeah, that was something that I had noticed in my fieldwork rotation. All in all, we do see patients regardless of whether they have a referral from the doctor or not, because we are able to receive the referral from any doctor within the area um, at a short notice. So yeah, either way, we do perform the evaluation, and everything works out fine in that sense. So I just kind of go with the flow, and I do question some things, but everything works pretty well in the sense that even if the patient doesn't have a referral, they are able to get one pretty fast, probably within the week and maybe even less. So yeah, anyway, that's the policy issue that I had noticed at the at my field 2A, my fieldwork 2A clinical rotation. Thank you for listening.